I also want you to know that today, as we work to ensure that children can achieve quality learning in the state of Mississippi, we are going to announce 2 measures to increase access to health care and COVID-19 prevention in our schools. First, we are expanding school-based emergency telehealth coverage throughout the state of Mississippi. This will allow schools, even those without school nurses or school-based clinics, to access telehealth services. A physician, a nurse practitioner, or physician assistant will be able to provide remote services in schools across the state. This is a program that originated from the Mississippi Division of Medicaid, and many of you have seen Drew Snyder, our very capable director of the Division of Medicaid, over the last several months, and I've asked him to come today to share some more details with us about this program. Drew, thank you for being here, and the program is yours.
Thank you very much, Governor. Since the beginning of the COVID-19 outbreak in Mississippi, Governor Reeves has made it a priority to leverage telehealth services as much as possible to increase access to health care while limiting unnecessary travel and potential exposure. Under flexibilities granted by the Centers for Medicare and Medicaid Services, the Governor announced in March that the Division of Medicaid was extending its coverage of telehealth services in a number of ways, which included allowing beneficiaries to access telemedicine from their homes. With the new school year beginning, we have now enhanced access to school-based telehealth coverage for as many as 270,000 Medicaid beneficiaries by allowing any school to serve as a temporary originating site for a telehealth visit. Traditionally, telehealth services are delivered by a Medicaid provider located at a distant site to a beneficiary located at an originating site, such as a local doctor's office, with a telepresenter who facilitates the encounter. DOM's telehealth policy already allowed a school-based clinic staffed by a physician, nurse practitioner, or physician assistant to serve as an originating site for a Medicaid beneficiary in need of services beyond the range of the clinic. However, many schools across the state do not have a school-based clinic or a full-time nurse on staff. With this change to the Division of Medicaid's emergency telehealth policy, any school can serve as the originating site as long as a telepresenter is present for the encounter between the beneficiary and the distant site healthcare provider. Telepresenters can include registered nurses employed by a school district or staff employed by a community clinic. This allows those community providers to build connections with their local schools and supply telepresenters as the need arises. Our hope is that this new policy will increase the likelihood that children can get more timely and efficient care without having to leave the school and without creating additional burdens on parents or the schools themselves. We believe this will also promote the safety of healthcare workers by allowing them to deliver more services virtually. The change took place August 1st and will remain in effect throughout the duration of the public health emergency. I appreciate the collaboration and support we received from the Mississippi Rural Health Association and the Department of Education in making this change possible. And I'd also like to thank Governor Reeves for making access to telehealth services a key part of the state's response to the COVID-19 pandemic. As an agency, the Division of Medicaid has been focused on improving access to needed services, and this new policy aims to make it easier and safer for those in our classrooms to get the care that they need.
Thank you, Drew. We really appreciate all of your efforts. One of the things that we've tried to highlight over the last 6 months is as we attack this virus and we deal with the repercussions of the spread of the virus, is the innovative ways that our state agencies are going about dealing with the new challenges that we face. This is just yet another example of Drew and his team being innovative, doing everything in their control and power under our direction to make sure that we provide these services for the students who need them. We also know that testing can allow us to help prevent the spread of the virus by immediately identifying and isolating known cases. As teachers return to the classroom, We want to make it as simple as possible for them to get access to testing. Dr. Dobbs and I have met numerous times over the last week or so with respect to this, and while we all know that we cannot fling the doors wide open on testing requirements for all because of the limits of primarily the national private testing labs, we can provide more flexibility for our teachers to provide peace of mind and confidence that they are COVID-free. Starting this week, teachers will be allowed to receive tests administered by our public health lab even if they do not exhibit symptoms and have not been in close contact with a known case. There will be several avenues for that we will be rolling out in the coming days and weeks, and Dr. Dobbs will provide more details on those. But I do believe that this increased access to testing and telehealth will help ensure that our schools can remain safe and education can occur in the state of Mississippi. Remember, when it comes to the reopening of schools, as Dr. Redfield with the CDC said, the question is of public health versus public health. We know that there are risks with opening schools, and we know that there are risks if we choose not to open schools. So our job, once we have decided to do everything we can to safely reopen schools, is to then administer and find programs to mitigate risk as much as possible. Dr. Dobbs?
Thank you, Governor. I'll go ahead and start off talking about some of the details of the teacher testing as it will become available. There'll be multiple mechanisms through which this testing will be available to teachers and faculty K through 12. Of course, the testing clinic on West Street will be available. We also will use our community testing sites that we have active, 2 sites across the state every day. But in addition, we're going to have 16 testing teams regionally throughout the state, and they're going to rotate at the county health departments and do drive-through testing that will be available on an ongoing manner. It should be beginning next week. As we have more details of this, we will make sure that we post it and available so that teachers have and other faculty members have all the details that they need to make sure they can get tested when they need to get tested. Jumping over to the numbers, we have 276 new cases reported today and 11 additional deaths. I would like to just state this is a remarkable opportunity that if we make the right decisions and really focus on limiting transmission at this moment, we can have an entirely different trajectory than we might otherwise. If we let our guard down, and we do have some challenges going into the next few weeks with schools opening up, because we are seeing exposures happening within the schools, and with colleges especially, and many of you may have been monitoring some of the activity in colleges. We've seen massive, parties that violate the rules as they are. And there are going to be outbreaks in those scenarios. So we have some real opportunities. We also have some real threats. And certainly we'll be working closely with all partners to see what we can do about that. But I encourage everyone to please double down, mask up, maintain your distance, avoid groups. And if you have kids in college, tell them to stay home and stay in small groups, because we're going to have some real trouble out of that, I have no doubt. If we're jumping over to our school numbers as far as cases and quarantine, we will have finalized reports on every Monday. We're still onboarding schools. We have 220-something reporting schools today, but a lot of them haven't really opened up yet. So there's still sort of other work to do to make sure we get the full range of schools. And obviously some are still virtual, so they wouldn't be sending in information. But of the reporting schools, we have 71 counties that have reported cases within a school system. Again, that doesn't mean they caught it there. Most likely, they brought it with them when they were going to school that they caught from the community. Among teachers, we have reported a total of 245 cases, and among students, 199. If we look at the numbers of those that are under quarantine, among teachers, we have 589 that are under quarantine at present and 2,035 students thus far. We'll continue to update this information and work with our schools to make sure that all of the processes are working smoothly. The last thing I would like to mention is flu season's coming up, and we don't want to have a bad combination flu season and COVID season. So please get your flu shot. We know pharmacies are starting to stock the flu vaccine now, so I would encourage everyone to go ahead, go out, get the flu vaccine, especially the people who don't think they need the flu vaccine. Everybody needs the flu vaccine. If you're young and healthy and are not worried about the flu, get the flu vaccine. We have young people who die from the flu every year, but we certainly don't want to have flu and COVID at the same time, not only making people sicker, but also too overwhelming our health system, which is already stretched as tight as it can be stretched. Governor, that's all I have. Thank you.